EGRT is an initiative that I'm leading now. It's ethics guided radiation therapy. So it is the radiation therapy, but ethically guided. And the reason for this, because sometimes we may face certain circumstances that the person or the institute can whether ask themselves whether this is ethically guided or not. Even in the research, sometimes whether this research is ethically guided or not. So I'm raising this initiative and willing down the road to draft a statement, kind of guidelines to refine the practice and research in radiation oncology. So I'm going to present the initiative, the concept of this initiative, what will be the steps that I'm going to arrange, and this will include the global survey and then consensus between the experts, and after that we'll release the findings, and hopefully it will be sponsored and endorsed by the professional organizations that is famous in the field of radiation oncology. We as radiation oncologists sometimes facing some circumstances, whether, just for example, I have a breast patient and I have a study that recommending 50 gray in 25 sessions, and another study is recommending 26 gray in 5 sessions. So obviously the 5 sessions is more convenient to the patient and also to the publicly funded institutes. However, the 25 sessions might be favored if I am working at a private setup, because more fractions, this means more incentive to the treating physician or to the private institute. So I need to end up with a statement, with the guidelines, how we can choose what is better for the patient, that is meeting more patient-centered care rather than like physician or institute-centered care. So this is the point. There are many examples in our daily practice. We need to be aligned and refined according to the EGRT principles. EGRT is important because if we will keep the clinical practice not interacted with the medical ethics, sometimes the clinical practice will be moving to malpractice. The clinical practice will be moving to money-minded practice. The clinical practice will be moving to personal interest practice. So we need to put kind of guidelines and statements that will refine the practice and meet the best interest of the patients, which is the target of our practice down the road. So in low middle income countries, we have many issues, and I will mention 2 things. In the low middle income countries, in the publicly funded sectors, sometimes we need to have certain guidelines that is ethically sound, and we want to apply it for the patients. At the same time, in the low middle income countries, we have also private sectors, and sometimes that private sectors, because of the situation, they want to grow as much as possible, and sometimes this growing can be regardless of of the ethical guidance and the principles. So it's important for the low middle income countries and also for the high income countries, because even in the high income countries, if we don't have this guidance from the medical ethics, we will be in a tunnel with many of things that can keep us away from the medical ethics field. So even in research, sometimes there is a need for a trial, but that trial is not obviously ethically sound. And when we are arguing this with the people responsible for the trial, they are saying we don't have level 1 evidence. However, there is no need to have this example, or there's no need to have this level 1 evidence, and we know mostly that this trial will be ending as a positive trial. So why we are putting certain group of patients in the control arm, and we know that the investigated arm is mostly going to be a positive trial? So to me, it sounds unethical to approve this trial, because mostly it will be a positive trial. So there is no need. You can just go ahead. For example, water and orange, and you are thirsty. There is no need for a trial to prove that the water is better than orange for thirsty patient. Water is superior to improve this level of problem. So sometimes there are certain problems in clinical practice that are so obvious, and there is no need for a trial. I know that clinical trials is very important to refine the practice, but sometimes we are overusing the research and the trials, and sometimes the victims are the patient. Like early this year, I put this editorial, and then we formed a group of the investigators from over 25 members across the globe, from Japan till Canada, and through the Middle East and Europe. And now we are in the process of the global survey. We are in the process of IRB approval to get this survey ready. And then hopefully by early next year, the findings will be presented and published. And hopefully it will be endorsed by certain organizations. So the EGRT concept will be more as a roadmap for all the practitioners in radiation oncology across the globe.